I know you mentioned that your pain was more in the upper central back, okay, but I would like to assess your gait and just see the way you're walking to assess if you have any issues stemming from your hips, pronation of the feet, etc. So just take a couple steps toward me. Okay, very good. Now stop. Okay, very good. Turn around. All right, just a couple steps slowly. All right, stop. Okay, I'm not seeing any asymmetry present that would contribute to the problem. Just gonna palpate the spine. Okay, and that's where the pain is here?
Yes.
Okay, I'm gonna rule out any issues with the knees and feet, so I'm just gonna just examine. So go ahead and face me again. And just take a slight lunge. I want you to just like step forward one step naturally and just bend that knee. Okay, you can keep that back leg straight if you can. Perfect. I'm just feeling for any muscle protrusions. Okay, so just try to stay that way. If it gets too painful, let me know and you can take a rest. But it's important for me to see when these muscles are engaged, if anything is sticking out to me. Okay, any issues with the knees?
No, no pain.
No? Okay, I'm just going to palpate the kneecap to make sure I'm feeling a healthy alignment here. Okay, good. I don't feel any looseness of the lower kneecap, which is a common, is the common origin for a lot of pain, so that's good. Your shins feel healthy. Okay. So what I want you to do, if you can, is to take your feet like that, and I want you to just rotate your knee in a circle. Okay. And I want to feeling the ankles for any cracking or popping, any issues that might stem from the joints. Okay. Very healthy. Your ligaments seem very fluid. No, I'm not hearing or feeling any signs of early onset arthritis or any kind of issues with the joint, so that's good. Was that easy for you to do?
Yeah.
Pretty easy?
Yeah, it was okay.
Go ahead and switch feet and see if you can do the same. Okay. Well, first I'm just going to palpate, so make that lunge. Very good. Okay, same thing with the kneecaps here. Very sturdy, which is not always the case. So that's good. And how often do you do your runs? Did you say?
2 to 3 times a week.
Okay, all right, and how long?
30 minutes.
Okay, all right, well that seems like a really good workout routine. It doesn't sound like you're overdoing it, but sometimes it could be the shoes we wear. Okay, go ahead and do the rotation if you can. Okay, I'm just feeling the joints here in the ankle and in the knee.
Yeah, I'm having some pain there.
Pain right here?
On the knee.
Knee? Okay, is it inside of the knee or outside?
Inside.
Inside, okay, so when I press here?
A little bit lower.
Okay, all right.
Yeah,
okay.
there.
Is it a soreness?
It's, yeah, sore and achy.
Okay, all right. So this might just be an issue of me needing to realign and do some work. I don't feel any misalignment. I don't feel, if there was something really wrong with the knee, I would, the bottom kneecap would be descending heavily and I would be hearing a lot of weird noises, which I don't. So I think this might just be an issue of you holding the wrong stance. Maybe you pulled something, but it doesn't seem to be like a chronic pain or a chronic issue. How long has this been going on?
A year.
A year. Okay. Is it every time you run?
Yeah.
Okay. All right. Wow. All right. I'm going to look into that, see if I can alleviate some of that pain.
Okay.
So I think next we're going to go ahead and have you sit on the bed. I'm going to take a look at your back and your shoulder muscles and also assess your cervical spine.
Okay.
Okay. So I'm going to start just by changing gloves and getting the hair out of your face just so I can inspect the cervical spine. Okay. Again, just like I did with the knee, I'm looking for any abnormal protrusions or signs that there could be a ligament tear. Okay, so just try to relax. I'm just feeling right now. Okay. I'm palpating the spinal discs. They seem to be in alignment. Okay. And so does the pain start beneath this line here, or is there pain above? Is there pain in the neck?
Above.
Pain in the neck, okay. Okay. I'm going to apply a little bit of oil. And using a ball roller technique, I'm just going to try to knead out some of the tension there because I do sense tension. The spinal discs seem to be healthy and in alignment, so that's a good thing. Just trying to simulate blood flow. I really need out some of this tension. It's important to do this before I do any kind of adjustment, such as spinal cracking, ligament cracking, because it serves as a baseline. You're going to be more receptive to the treatment if your blood circulation is flowing at a higher rate. So that's what we're aiming for. Okay, how does that feel?
That's good.
Okay. I'm going to be doing a little bit more pointed massage followed by pressure point therapy. You're going to see some redness here in the next 3 to 5 days, and that's a good sign. It's a sign that the area beneath the dermis is activated and your blood is finding new ways, healthier ways to oxygenate and circulate throughout the body. You should feel some slight soreness, but nothing too painful. Are you comfortable?
Yes.
Okay, good. So this area is starting to redden. I feel a huge muscle buildup here, and this is in the scapula muscle. The latissimus dorsi is a little bit lower, so but the scapula is the area where I see it is the most inflamed, and I'm feeling masses of tension. Okay, so I'm going to just really hone in on those areas. And the other side. Actually, the right side is pretty bad as well. Okay. We'll be doing some pressure point therapy here. Okay, before I move on, I'm going to do just some light cupping therapy in the scapula. Okay. Okay. I'm just encouraging the tension to move outwards. Because we tend to hold the tension and the muscle masses that we develop over time tend to veer towards the center and the upper part of the body. And we want to move those outward toward the sides, just so tension and the oxygen we carry is evenly distributed. You feel any pain at all? Okay, good. It should just feel like a pressure and actually a release of tension. Very good. Just a few more on this side. I'll move to the other, the opposing scapula. Okay. a lot of tension here. Okay. Just going to switch to the smaller cupping tool. Okay, so for now I think that's good. I'm going to move on to the mid and lower back, okay? So I'm just going to start by massaging the entire midsection of your lower back, getting your scalp, your scapula, and the latissimus dorsi. Down to the rhomboid minor and rhomboid major. So I'm applying moderate pressure, trying to go a lot lighter on the upper to mid back here because I really want to encourage blood flow without adding to the tension. When you're not healed properly and you're receiving all of these massages, if I do it too hard, it could cause the opposite effect where your muscles tense up even more. So just trying to encourage movement where there had been stagnation. Okay. All right. So I'm going to do a slight adjustment. If you could put your arms to your sides, directly to your sides. Okay. So on the count of 3, I want you to take a deep breath in, and when you exhale, I'm going to push down, okay? And I want you to completely exhale all the way, letting your lungs completely empty. Okay, 1, 2, 3. And release. Good, okay. Once more. 1, 2, 3. Good, and release. Very good, okay. Just gonna follow up with some more massages. This should feel a little bit lighter, a little bit smoother of an impact. Again, going lighter on the upper body. Okay. Smoothing out your leg muscles. I don't sense any real tightness. Is that okay?
Yes.
Okay.
It's a little bit ticklish.
Ticklish? Okay. All right, well, I was just about to wrap up, so there, you can have some relief there. Going to be using this cupping tool to have a similar effect, but kind of works in different ways. Again, starting from the center and moving outward toward the edges of the body, just to kind of brush out that tension and encourage it to move this way naturally. Okay. Since you mentioned issues with the knees, I'm going to do some cupping behind the knees just to help stimulate blood flow from the back. Just moving in a circular motion. Okay. Okay, so now I'm going to have you flip over. I'm going to do some adjustments to your upper body and to the front of your body, and I'm going to see if I can crack your toes and get you in a more comfortable state. So I'm going to do some just alignment and cracking of the hands. First, I'm going to ask you to just give me all of your weight right now, all of the weight in your hands. I'm just going to be pulling, stretching you as much as possible, really trying to close that gap that's created, and lengthen the gap, the section that's created when we tense up our muscles throughout the day. So just give me all your weight. Don't think too hard about it. Just pulling here. Good. And the joints feel very healthy to me. I'm not feeling any abnormal sounds. I'm not feeling anything out of line. So that's good. Just going to be gently pulling on the joints. They may crack, they may not, but it's going to help alleviate tension. Okay. Okay. These are really gorgeous nails. Thank you. Okay. Okay. Moving on to the toes. All right. So just relax your feet completely. And actually, yeah, again, give me your weight. Good. Okay. Taking the other leg. Okay, we got one to crack, so that's good. All right. So I'm going to be doing some tapping therapy around the kneecaps just to try to pinpoint the source of your ache and try to spread out the tension that you have and maybe retrain the muscles in your knee to realign in a more healing way. Okay? So just relax. And let me know if you feel any sudden pain. Very lightly in the center. Okay. Right. So lastly, Mad P, I'm going to do some adjustments or 2 adjustments to your body, to your core, okay? And this is going to help your whole body realign, and it's going to help your posture, which is important. So go ahead and place your hands in a crisscross formation. Very good. Okay, so I'm going to take this knee, bring it up. I'm going to bend it this way. And at the same time, I'm going to twist your opposing shoulder in the opposite. All right. So in 3, 2, 1. Okay, how'd that feel? Good. Okay, good. All right, go ahead and switch arms. Arms, yeah. Okay. And we're gonna go this way this time. 3, 2, 1. Okay, how was that for you?
Good.
Okay, great. All right, so based on what we've done today, I want to see if this actually works for you. If you don't, I can send you in the direction of kind of pursuing a more medical route and healing your aches. If it has helped, I'd love to see you again in a couple weeks, okay? And we'll just do something similar, maybe try different forms of massage therapy, but really keeping with that cupping therapy. The tapping, I really believe, helps. And realignment of your entire body, okay? Because you deserve to be pain-free.
Thank you.
Okay. All right, great. Well, get up on your own time, and I'll see you out front. Okay, thanks for coming in today.
Thanks.